going on from receptors, antibodies, to using some of the mechanisms that the cell uses. So what would be a typical checklist that you would go through in order to design a nanoparticle for a specific application? And the second question, if I may, is what's the resolution you get with the spectral CT?
The last one, it's the same as CT. Okay, it's just a matter of the counting. And actually we use a low-dose counting approach. On that scanner, it's 0.1 millimeter slice thickness, so 50 microns is possible. The way we go through it, and it's a good question that you asked, is I take a white paper to every problem and start fresh. So the question, first of all, is what is the target, and can I get there, and what's it going to take? So for instance, if you're talking about extravascular versus intravascular, it's a whole different size particle that begins. And even then, it's not so easy to get across these barriers, so you have to think about what you're going to do to get there, whether you're going to use calveoli or something else. But for the intravascular ones, let's refer to those, since those are, I think, the first ones that'll reach the clinic most. I look at what the receptor numbers are going to be, and then I try to define what's pathognomonic for them that wouldn't be seen in other parts of the endothelium. But if you use a small molecule, for instance, for alpha beta 3, that's upregulated on many, many tumor cells, many, many small cells. So when you use something like that, like say with a PET agent, you're not just getting angiogenesis, you're getting every place AVB3 exists. So that's very confounded and not really neovascular. That's more like a hotspot imaging of something abnormal. So with the particles, you can constrain them to the vasculature, and therefore you can get to